All right, everybody, welcome to the session. We're so happy that you're here. Um, this is the Western Asia and Muslim culture and bleeding disorders session. And we're especially happy because it's been a priority within NHF for the last few years to intentionally create space for smaller communities within the bleeding disorders community to be able to gather and share their shared experiences within their culture. And so this is the first time that we have this space for the Western Asia / Muslim community. And so we're very happy to bring this session to you, especially since I'm happy to introduce, we have 3 NYLI members. And if you guys can go ahead and say hello now.
Hi, I'm Ali Haidar.
Hi, my name is Laila Jaffrey.
How's it going, everyone? My name is Burak.
So they will be sharing their stories with you throughout the session. And really, we would love for this to be as interactive as possible. And that means in this session, we would love to hear from you in the chat. So please, if you have any stories or any shared experiences similar to any of the things we'll be talking about here, we would love to hear from you in the chat.
Hi, everyone. I'm Ali Haidar, and due to a couple health issues, Burak is actually going to be saying my story for me, so hope you enjoy.
Yes, so I'm going to go ahead and begin with Ali's story, actually. So here goes. My name is Ali Haidar. I'm 21 years old, currently a second-year NYLI member and diagnosed with factor 13 deficiency. I'm a first-generation American with a Lebanese background, and with both parents coming from there. My older sister was diagnosed first. She had severe umbilical cord bleeding, which was an obvious sign that something was wrong. It took some time, but she was finally diagnosed with factor 13 deficiency, which is a very rare bleeding disorder. It's 1 in 5 million. After she was diagnosed, everyone else in the family was tested, and it turned out that I was also factor 13 deficient. I don't remember much of my early childhood experiences with my bleeding disorder. All I remember was going to the hospital and getting treated. A few years ago, a new medication came out for factor 13, and I had to go to the hospital several times a week for testing, which was getting in the way of my work. My father confronted me about it and asked why I needed to do it, and I tried explaining how the new medication was 10 times fewer units than my previous human product, meaning shorter infusion times and less blown veins. But he did not agree with what I was saying. My father then went on to say that he did not believe I had a bleeding disorder for several reasons, and said that if he could, he would not give me medication to prove it. It's been a struggle with my bleeding disorder and living in a Muslim Arab household over the years. The worst feeling is when someone such as myself has several other health issues due to factor 13, such as arthritis, bleeding gums, and scheduling my life around my treatment. And one of my parents didn't agree with the diagnosis, thinking it was all some conspiracy. I understood that later on, my father would never truly understand the struggle of living with a bleeding disorder, and chose to just accept that fact. With help from my hematologist and social worker, I slowly started getting through to him. He finally understands that without medication, I could very easily get hurt and bleed. So the progress is there. There's still a long road ahead, but it's slowly getting better. And if you are having any similar issues with this, do not give up on it. One thing I did include bringing over family friends who are medical professionals and having them explain to my father what my diagnosis was and why the medication is always important to have. It helped a lot since the diagnosis was being explained to him by someone he trusts and in his primary language as well. Yeah. So while I'm actually going through these bullet points, everybody, just you guys are more than welcome to share your personal experience, any relatable experience that you have with these bullet points, and if you do have any stories that you did want to share, you guys are much encouraged to leave those in the chat. So while I'm going through these, feel free to do exactly that. The first point that we did touch upon was the acceptance of diagnosis. We do see this occurring pretty frequently in Muslim households. not every parent is, accepting of the fact that, their child has this bleeding disorder, which requires, medical attention. It's pretty common that we see that. This also ties into the fact that, they also believe that, Western medicine isn't always welcome in the household. And this does have repercussions because obviously the patient can't receive the necessary treatment that they need. And in Ali's case, actually, the fact that, someone close to his dad was able to relay that information to him, it made it much more helpful for him to understand and be more accepting of the fact that, he had a disorder that required attention. That's beside the fact that there is medicine stigma most of the time in these households. Even in mine, there was a hint of this, but with recombinant factor, and there was also this notion that there was gelatin in some medication. And this is a really important detail because in Islam, gelatin is forbidden in any type of way, any way, shape, or form. So it's super, super tricky when you have a medication that contains gelatin because, here you are with this, ethical, religious dilemma. Either you have, your treatment or you do something that goes against your religion, which is a, really tough spot to be in. Holistic remedies, I definitely do see them to be, more prevalent in the future. Obviously, people are starting to step away from, standard medicine and move into more holistic options. So that's also a really good thing. Navigating family acceptance. If you guys have any, stories to share about that, navigating. Obviously, for me, it wasn't too much of a hassle, but there was some, bumps along the road, and just relaying to my parents that, I did have this disorder and that these are the necessary steps that needs to be taken in order to ensure that, I do live a, healthy, active, normal life, and it's totally possible to do that. So I think we can move on to the next slide, which is my story, actually. So just to tell you guys a little bit about my own story. My parents actually immigrated from Turkey to the United States in 1999, and we've been living here in New York ever since. So for me, in my case, I got diagnosed when I was about a year old. The same year that my parents actually immigrated to Turkey, actually, was the year I was born, and ultimately the year that I got diagnosed. So when I was a year old, I actually had fell off my bed while I was sleeping, and that resulted in a more than unusual, amount of swelling in my chest. And, obviously we had to, take me straight to the doctors. And, after an examination, that's when I was completely diagnosed with hemophilia A severe. So there was actually a couple of hurdles that came up throughout this process, because ever since that day that I did get diagnosed, that was truly the the day that I embarked on this hemophilia journey, living with hemophilia. And so there's a couple of hurdles that actually come with that. For me, in my case, the two hurdles that I faced were the navigating the insurance and the language barrier. And I think these are really important subjects to touch upon, because obviously for immigrants that just moved into the United States, hasn't been a year. Here they are faced with this situation where their child is diagnosed with hemophilia, and it's crucial to be able to have someone to relay that information from the doctor to them in a way that their parents are informed. So in my case, I was super blessed, super lucky to have an older brother and an older cousin who were both 10 years old at the time, actually. And they were absolutely instrumental in, making sure that my parents were not only informed of, my condition and like everything that came with it in this, journey that they were about to embark on, but also the fact that they had a strategy for what to do next. Because no parent wants to be in a position where they're, they don't know what to do with their kid when they have a, bleeding disorder. Yeah. So let's see. So and then so what I was saying earlier is, if you guys have any, if you guys do have any, stories to share regarding these topics, I'm gonna go through them again, just like last time. And then, like I said, you guys are much more than encouraged to share any relatable experiences, and you can actually just leave those in the chat as well. So, so while we are going through, the language barrier obviously was, one of the biggest barriers. Given the fact that my parents, it hasn't even been a year since my parents were in the United States, I could see it being a very big problem to people that just move in, especially immigrants, of course. In my case, like I said, I was super lucky to have an older brother and an older cousin to help make that process go smoother. But then again, I think it's also really important to be mindful of the fact that that was 20 years ago, and I'm sure that nowadays, hopefully at least, there are translators in the hospital that can make sure that the parent is fully informed, fully able to comprehend what their child is being diagnosed with. So the other hurdle, actually, the insurance part, this was actually really tough for my family, actually. Thankfully, it worked out pretty okay. But my mom, actually, the way I was able to get insured, because um, we could all agree on the fact that having a rare bleeding disorder, getting insured for your rare bleeding disorder, it's much more different than being insured standardly or just for basic insurance. It's a lot more tricky. So I was, like I said, I was super blessed to have an older brother and a cousin that were able to help slightly with that. But then again, with having a bleeding disorder and making sure you get insured, it's definitely a lot more tricky. So I don't think that having a brother or an older brother or a cousin would be able to be enough actually for this, because it's a lot more tricky than that for sure. Yeah. Okay.
Hi everyone, my name is Laila Jaffrey and I'm NYLF first member. I am factor 10 carrier and my siblings are diagnosed with severe factor 10 deficiency. I am Muslim and I have migrated from Pakistan 3 years ago. So before starting, if you have any story, please do post on the chat. So today I'm gonna share my brother's story. So my brother usually sits while praying and he faces a lot of difficulty while standing again and again for praying. And having bleeding disorder is often seen as contagious and more often compared to AIDS. And even in school, their teachers told them like living with bleeding disorder is one of the world's top worst disease. And people who have bleeding disorder shouldn't have kids, so they can't transfer their misery to their kids.
Yeah. Yeah, Layla touched about some really good points. In my case, so for me, so since I am Muslim and I do practice Islam, it's the faith that I grew up with in my household. And obviously staying active, I did stay active, growing up. It was tricky to to have to practice my faith and still make sure that I was fulfilling all obligations of my routine medication consistently. So it kind of puts you in a position where you have to juggle, your faith and your making sure that you get your medication on time too. So in my case, since I was growing up active, that would probably require me to infuse much more. But the part where it gets tricky is actually the fact that so in Islam, during the month of Ramadan, where we can't eat until sunset, which is usually around 8:30 to 9 p.m. It really depends on which part of the world that you're in, but it's universally sunset. So from sunup to sundown, we can't have any type of meal. Now this also includes anything intravenous. So if I were to infuse during the hours that I'm supposed to be fasting, that would automatically break my fast. And that would result in me having to make up for it at the end of the month. But that day will not count. So it's kind of moments like this where things do get a little bit tricky. But I was able to get around it by by having to infuse after sunset. But the area that I think that some people would have problems with is say if I were to get like a super spontaneous injury that required me to infuse, but it was within the hours that I was supposed to be fasting. So now I'm in this position where I have to infuse, because otherwise I'm going to suffer huge medical repercussions at the expense of me not fulfilling the obligations of my religion. So it is a couple. It does get tricky sometimes, but I think it is also manageable too in some areas. Yeah.
Hi everyone, Ali again. I do have another story which Burak is going to kindly be reading for me.
So I'm going to go ahead and read Ali's cultural interactions part. Here goes. A very common stigma in both the Arab and Muslim communities, unfortunately, is any diagnosis that the parent cannot see, feel, or touch. When the science of the diagnosis is very complicated, especially if it's coming from Western medical personnel, the communities brush it aside and reject the diagnosis. This is something that affects many people, and not just people with bleeding disorders. And then if you guys had any, and then like I said earlier, with all these slides, if you could relate to any of these subjects, just go ahead and share your personal story in the chat. You don't have to get too much into detail, just whatever you guys are comfortable with, but we do encourage you guys to share your experiences in the chat.
Hi everyone, I'm Lela again. And before starting, if you have any story or you can relate any stuff with me, you can most welcome to post on chat. So in this slide, I'm going to touch about in Ramadan. So in Ramadan, for my siblings, it's really difficult for them to infuse every week in the morning, since like they are in prophylaxis. And to wake up every morning, it's really hard to find brains. And another one more concern is Hajj for my parents, since like in Hajj is really a crowded place and it's really hard to perform Hajj. And also for the prayers, before prayer you have to wash yourself, and it's called wudu, and for that you have to lift your legs. So it's really difficult for them to lift their legs and to wash because they have joint bleeds. And also I've seen like bleeding disorder is often seen as like bad eye spirit and like contagious. So if anyone can relate with my story, of anything to share, please do post on the chat. Hi, I'm Lela again. So I have a sister who's diagnosed with factor 10 deficiency. And for my sister, she has very heavy and long periods. And she wakes up every night to change. Misses her school due to heavy periods, and it lasted for 7 days. And sometimes it lasts more than like twice a month. And she took birth controls for a very long time. And people used to look down to her and think like she might not have kids, and she have gained weight or she have hair fall, and it's really difficult for her to like talk about it. So if you have any story, please do share. And for the women's consideration, there's also a stigma of like finding a female OBGYN. So even with my sister, she can't even like talk with the male. She found it really hard to even talk with the male and talk about his like difficult stuff. And also like there's also for my parents, they are concerned about like her marriage and rejection, like how people treat with bleeding disorder. And there's still a stigma of like having bleeding disorder and with the marriage. So if you have anything you can relate with me, please do share.
So Layla went over the women's considerations aspect of it. So I guess we can go over the men's considerations. But before I do that, when you guys are reading these bullet points, just go ahead and leave any type of personal, relatable experience. Like I said, we're more than welcome to share those in the chat. It's encouraged, actually. So for mobility limitations, Layla made a really good point on getting wudu is what it's called. It's the act of cleansing your body to get ready to pray. I believe the English word is ablution for that. But the reason that it could be hard for hemophilia patients is because it does require you to be somewhat mobile. For people with joint problems, with frequent joint bleeds, target joints in their elbows, knees, this could be super difficult because one of the parts of ablution that requires it requires you to actually lift your leg into the sink so that you can wash your feet. Because we do wash both feet when getting ablution or practicing wudu. It's obvious that this could be super difficult for people that have joint bleeds and elbow bleeds, just because you are required to be mobile. The other bullet point was being seen as not enough. There's a notion in some non-Western societies where obviously if you can't see the disorder, if you can't visibly see the effect as to why someone is quote unquote incapable, then there's a judgment based on that person. So the active lifestyle, with me growing up active, it did make me more prone to injury, and that did actually have some repercussions on my faith because, like I was saying earlier, with the fact that I had to infuse during the day, I have been in positions where I had to, not where I had to essentially break my fast because I was suffering a bleed that required me to infuse. So I've been in these positions before. The other aspect of it is marriage. This is also a really big topic because it's like I do see it coming up where having the conversation where you share your bleeding disorder to your significant other, and they may be they just may not be willing to accept that that aspect of it, and it's unfortunate, but it does I do definitely see it as a possibility.
Hi everyone, it's Leila again. And since I've migrated 3 years back and worked for my hometown chapter, I want to talk about some international issues for my international guests. So if you can relate with any of the issue, please do share with us. So medication availability is a big concern in developing countries, especially for rare bleeding disorder. And the plasma is the only option for us. And so the plasma is the only option for us, which can increase the HIV discrimination. And there's still a lot of stigma for HIV discrimination. And sometimes doctors don't know how to treat it, especially for the rare bleeding disorder, and they reject it due to the, like, it's so rare and it's so risky, so people do reject it with the rare bleeding disorder. And job discrimination is also a big concern. And with the job discrimination, people think like having bleeding disorder, you are so weak, and so they don't give you a job. So if you have anything, please do share with us.
All right, so that brings us to the end of our session. We would love to hear from you in the chat. We built in some time for that, so that's why we are ending just a little bit early. But if anyone has any questions, we would love to hear from you. We'd love to hear some stories. Perhaps if you relate with anything that was said in this session, we'd love to hear from you. And really just to create some space for everyone within this smaller community, within the bleeding disorders community, to have a space to interact. So if you have anything that you'd like to share, please post in the chat. And then regarding evaluation, you will receive an email either tonight or tomorrow asking you to complete an evaluation, and there's a raffle for that as well. So we're trying to incentivize as many folks as possible. If you are an attendee here who is a member of the Western Asian or Muslim culture or community, then we'd especially love to hear from you. Did you like this session? Would you like to see another session similar to this next year? Hopefully we'll be in person next year. We can gather in person, but especially we'd love to hear from you what your needs are and how NHF can better serve this community.